I'd now like to introduce our presenters today. Dr. Thuy Nguyen is a clinical pharmacist with special interest in chronic pain management and addictions treatment. She obtained her Bachelor of Science in Pharmacy from UBC in 1994 and a Doctor of Pharmacy degree from the University of Washington in 2010. She worked as a community pharmacist for 7 years, as a special authority pharmacist with the Ministry of Health for 1 year, and as a pharmacy advisor at WorkSafe BC for 10 years. At WorkSafe BC, Dr. Nguyen worked with physicians and adjudicators to optimize the injured workers' chronic pain management. Currently, she's a pharmacist consultant providing educational programs to pharmacists with regards to chronic pain management. Welcome, Dr. Nguyen.
Hello, everybody. Thank you for joining us today.
And yes, thank you for being with us. And Dr. Marylene Kyriazis is a doctor of pharmacy. Her background is predominantly in community pharmacy practice with special interests in men's health, palliative care, and pain management. As a clinical instructor with UBC Pharmaceutical Sciences, she has been a preceptor for second, third, and fourth year pharmacy students. Currently, Dr. Kyriazis is a consultant clinical pharmacist working in the field of pain management. Welcome, Dr. Kyriazis.
Thank you, Michael, and I'd like to welcome all the participants here today.
Yes, excellent. Thank you for joining us, and I apologize again for the technical problems. Let's get started with the presentation. Go ahead.
Okay, so today we're going to be talking about medication access, how to navigate Pharmacare in particular, but we will be mentioning other plans as well. So really we'll be trying to give you a general overview of the coverage of pain medications in BC. So in terms of drug coverage, we have a couple of primary plans. Pharmacare is the biggest one. We also have Veteran Affairs Canada, non-insured health benefits for First Nations and Inuit, known as NIHB, WorkSafe BC, and RCMP. These are all considered primary plans, and the billing to the primary plans is done directly through the pharmacy, and this is known as online billing. Further to that, we have secondary plans, which are also known as extended healthcare plans, and I've mentioned a few of them here. There's Pacific Blue Cross, RX Plus, Shared Health, Tenant Health Solutions, Green Shield, Eclipse, Manulife, Maritime Life, NextGen, Claim Secure, there's also Great West Life, and many, many others. And these are known as secondary plans, and the billing to secondary plans can either be done directly through the pharmacy, also known as online billing, or claims can be submitted manually by the patient. The decision on whether it's done online or submitted manually by the patient really depends on the type of plan that the patient is covered by. Some plans can only be done as a manual submission. So drug coverage in BC is a complicated process. As you've seen, this is a general overview. There are many different plans, and within these plans, there are many different coverage policies, and medications have in themselves got different coverage policies depending on what the coverage company has decided to cover. So we'll just do a general overview today of the rules and regulations of the different providers, third-party providers, and then in 2 weeks' time we will give you specific information about specific drugs related to pain management. So we'll begin with Pharmacare medication coverage. Firstly, who's eligible for Pharmacare coverage? Well, this applies to all BC residents, and in order for you to be eligible, you must be enrolled with Medical Services Plan of BC and registered for Pharmacare. So within Pharmacare, there are many different plans. I'd also like to mention that Pharmacare does not only cover the drug costs. Pharmacare can cover drug costs, but also other medical supplies, or anything else that's related to healthcare, but today we're focusing just on drug coverage. So within Pharmacare, we have 7 different plans. There's Fair Pharmacare. This is BC's income-based plan, and most BC residents are covered by this plan. There's Plan B, which covers residents of licensed care facilities. Plan C covers individuals receiving income assistance from the province of BC. Plan D covers individuals registered with cystic fibrosis clinic. Plan F covers children receiving assistance through the at-home program. Plan G covers clients of mental health service centres. And then there's also the BC Palliative Care Benefits Program. It is important to bear in mind that an individual can be covered under more than one pharmacare plan. So what medications are covered by pharmacare? Well, BC pharmacare covers a wide range of medications, but the medications that are covered must be prescribed by a physician or anybody else that's licensed to provide a prescription, like a dentist, midwife, nurse practitioner, optometrist, or podiatrist that is licensed and practicing in BC. What medications are not covered by pharmacare? This applies to any medications purchased outside the province of British Columbia, anything over and above pharmacare's allowances with respect to the dispensing fees, any medication costs above those that pharmacare accepts, and any over-the-counter medications. In terms of medications that are not covered by pharmacare, pharmacare will not cover any medications that it has decided not to cover. Pharmacare will not cover any medications which have not been submitted by the manufacturer for pharmacare coverage. They will not cover anything that is currently being considered for coverage until such decisions have been made. And it will not cover any medications that are provided through hospitals, BC Cancer Agency, BC Transplant Society, or the BC Renal Agency. So in other words, pharmacare covers medications that are obtained from community pharmacies only. Now, in terms of pharmacare coverage of specific drugs, if you want to know if a specific medication is covered, or if you want to know what quantity of a specific medication is covered, all this information will be discussed in Part 2, which is coming up on Thursday, February the 27th at 11 o'clock. In terms of calculation of coverage, if you're eligible for pharmacare medication coverage, pharmacare's share of your medication costs is calculated automatically at the time of purchase. You pay only the costs that are not covered by pharmacare. And there's a secure province-wide computer system called PharmaNet, which keeps track of all your prescription costs. So this keeps track of all prescriptions that you obtain within the province of BC. Now, in terms of pharmacare coverage policies, there are many items to cover here. We'll be covering the low-cost alternative program, known as the LCA program, the reference drug program, day supply, coverage of early fills of medication, travel supply policy, which drugs require pre-approval, how Fair Pharmacare works, and how Fair Pharmacare coverage is obtained. And in order to cover these, we will be moving on to the Health Canada website, where all the information is there, and I'll navigate you through the website and get information from there. So, Michael, do you want to help us to go into the website?
Yes, absolutely. So, Marylene, just click on the share application, okay, and then...
So I'll go on from there, okay.
Great. We're now seeing, we should be seeing, there we go. We're seeing your desktop now.
Okay, hang on, I've got another desktop, which is, sorry, just give me 1 second here. Okay. Can you see that, Michael? Ministry of Health? Yeah. Okay, so I'll close that. Okay. So we'll begin with the Fair Pharmacare plan. And who should register? Let us go Fair Pharmacare. Okay. Okay. So who should register for Fair Pharmacare? Fair PharmaCare is available to all British Columbians, and every British Columbian should be registered for Fair PharmaCare. If you're a BC resident and enrolled with the Medical Services Plan, register your family, that includes you, your spouse, and any dependent children, in order to receive your maximum assistance under Fair PharmaCare. So in order to be eligible, you need to have a BC Medical Services Plan coverage and have filed an income tax return for the relevant taxation year, which is 2 years ago. So PharmaCare coverage is based on tax returns from 2 years ago. So in terms of how Fair PharmaCare works, and the registration process is all online, so for those individuals who have not yet registered, their information on how to register is available here. So in terms of how Fair PharmaCare works, it is an income-based assistance program. Families with lower incomes receive more assistance than families with higher incomes. In terms of how your level of coverage is calculated, PharmaCare uses the net income from your and your spouse's income tax returns, and this is from 2 years ago. So, for example, the 2013 coverage will be calculated using your 2011 tax returns. Once your income tax information has been received by PharmaCare, PharmaCare figures out a deductible. And that means that your family pays your full prescription costs until you reach a level known as a deductible. Once you reach your deductible, PharmaCare begins assisting you with your eligible costs for the rest of the year. British Columbians with the lowest incomes do not need to meet a deductible, and they receive immediate assistance. Once you've reached your deductible, PharmaCare will pay 70% of your family's eligible costs for the rest of the year until you reach your family maximum. And the family maximum depends on your income as well. So there's a really nice table here, the Fair PharmaCare plans, that actually puts everything in an easy-to-read format. So if the family income is less than $15,000, there is no family deductible. PharmaCare pays 70% of the eligible costs, and the family maximum is equal to 2% of your net income, after which 100% of your drug costs are covered. There's an example of your family income between $15,000 and $30,000, and for this you need to reach your family deductible before PharmaCare will start paying 70% of your drug costs, and the same applies to anything over $30,000. There's an enhanced assistance program for anybody that's born in 1939 or earlier, and the difference there is that once your deductible is reached, PharmaCare will pay 75% of your drug costs until you reach the family maximum. Then there's some information on updating or changing your coverage. Now we'll move on to how Fair PharmaCare works. So general coverage policies. There is a dispensing fee policy. PharmaCare recognizes a maximum dispensing fee of $10 that it will cover. If a pharmacy charges anything more than $10 in terms of a dispensing fee, the difference is not covered by PharmaCare. There is also a limit to the number of dispensing fees that PharmaCare will cover. In terms of drug costs, PharmaCare often uses a low-cost alternative program known as the LCA program. This program focuses coverage on lower-priced generic drugs. Generic drugs have the same ingredient and deliver the same health benefits as brand-name drugs. So if you, by using the low-cost alternative program, PharmaCare saves money, and if you don't have 100% coverage, then you also save money on whatever you need to pay out of your own pocket. So under the LCA low-cost alternative program, generic drugs are placed in categories based on a specific drug strength and formulation. And PharmaCare sets a maximum amount that it will reimburse for the drugs within each category. So some brands may be partially covered up to the low-cost alternative price. If a drug is not covered or is only partially covered, you can choose to switch to a drug that is fully covered, or if the drug is not covered, pay the full cost of the drug, or if the drug is partially covered, pay the difference between the low-cost alternative price and the full drug price. Another program is called the Reference Drug Program. This is a program where there is more than one drug in a therapeutic class. PharmaCare provides full coverage of only those drugs considered to be the most medically effective and most cost-effective in the category. And this specific drug is called the reference drug. So at the moment, there are 5 classes of drugs that are included in the reference drug program. And out of these classes, the only one that would apply to pain patients would be the non-steroid or anti-inflammatory drugs. So within that class of anti-inflammatory drugs, there will be one drug that is fully covered by PharmaCare to deal with any anti-inflammatory issues. In terms of the day supply, PharmaCare pays for a maximum day supply, and this is drug dependent. So for most maintenance drugs, PharmaCare will limit the coverage to 100-day supply. There are certain drugs that PharmaCare limits the maximum coverage to 30-day supply, and this will apply to medications such as sleeping tablets or narcotics. In terms of coverage of early fills of medication, PharmaCare will not cover a prescription if you still have more than a 2-week supply of the drug. And that is irrespective of the original quantity of the medication that is dispensed. So in other words, if you get a 100-day supply of a medication, you need to have used up 86-day supply before you can have that refilled. If you get a 30-day supply of the medication, then you need to have used the first 16 days of that before you can have a refill, which is covered by PharmaCare. If you get a 2-week supply to begin with, then you're eligible for a refill the very next day and have it covered by PharmaCare. In terms of a travel supply policy, PharmaCare does not cover a prescription claim if you have more than 14 days supply left over. However, PharmaCare will allow you to fill a prescription earlier if you need a supply for travel outside BC. And in order for that to happen, there is a form that has to be filled in at the pharmacy with some more information that you have to supply to PharmaCare. Then there are some drugs that require pre-approval. These 2 categories are limited coverage drugs and drugs requiring special authority. For limited coverage drugs, these are medications that are not generally considered to be the standard first treatment of choice, or these are medications for which more cost-effective alternatives exist. PharmaCare provides access to these drugs when medical circumstances warrant through its special authority process, and that is described in the next section. So if you have a medical need for a drug included in the limited drug coverage program, your healthcare practitioner can submit a special authority request to PharmaCare explaining your medical need, and there's certain criteria that have to be met in order for you to get considered for coverage of that specific drug. Drugs requiring special authority coverage, again, a special authority grants full benefit status to a medication that would otherwise be a partial benefit or a limited coverage drug. Your healthcare practitioner, and that's specifically your physician, must submit the request for special authority. Special authorities are normally granted for a specific drug for an individual patient. In some cases, a special authority exemption may be granted to a physician or a physician specialist. Exemptions provide coverage of a specific drug for all patients of a physician or a group of specialists. Special authority coverage has got certain criteria that need to be met by the patient and their condition. And once you have special authority granted for a specific drug, it's a limited time special authority, and it has to be reapplied for and reapproved once the special authority expires. So it could be, the special authority coverage could be for a 6-month period, it could be for a year, or in extreme cases, it's indefinite. So In order to be eligible for coverage, special authority must be in place before you purchase a drug. Coverage cannot be provided retroactively. For drugs in these categories, you must have special authority approval before you fill a prescription. So for limited coverage drugs, all limited coverage drugs require special authority approval. For reference drugs, if you cannot take the reference product, your healthcare practitioner can request coverage of another drug. For low-cost alternatives, if you cannot take a lower-cost alternative, like a generic drug, for one or another reason, your health practitioner can request coverage of another drug for you. And the other two do not apply to pain medication. And so that is a very quick summary of PharmaCare and its coverage. Now we will move on to WorkSafe BC medication coverage, and I'll pass you on to Dr. Nguyen to share that area with you.
Thank you, Dr. Kyriazis. And again, thank you for joining us this morning. I'll be speaking about the WorkSafe BC medication coverage from the perspective of a community pharmacist. Before I start, I should disclose that I am an employee of WorkSafe BC. However, I'm not wearing my WCB hat today. I'm here as a community pharmacist and not as a representative from WorkSafe BC. And today I will not be able to answer your specific claim-specific questions. First of all, to be eligible for WorkSafe BC benefits, you must fulfill your responsibilities by reporting the injury to your employer, and you must seek medical attention as soon as possible after the injury, and you have to file a claim. And once a claim has been accepted, then all injury-related drug costs are covered from the date of your injury. So it is important that you file your claim right away, because as soon as your claim is accepted, a pharmacy benefit card will be sent to you, and you can use the card at any pharmacy throughout Canada to purchase your medication. And the pharmacy will bill WorkSafe BC directly for the cost of the injury-related medications, including the drug cost and the dispensing fee. Please note that not all medications are automatically covered through the pharmacy benefits card. Some drugs require pre-approval from your case managers, including opioids, sedatives, hypnotics, synthetic marijuana. WorkSafe BC does not pay for medical marijuana. And in 2 weeks' time, we'll be discussing the different procedure that you need to get pre-approval for these medications. And these are typically authorized on the pharmacy benefits card for very short durations of 2 weeks to 8 weeks, and then they require another review by the case managers and the medical advisors that work at WorkSafe before further extensions of coverage will be granted. And if the pharmacy cannot bill an injury-related medication to the pharmacy benefits card, your pharmacy can contact the WorkSafe BC pharmacy team at 604-276-3085, extensions 1655, if the call is being made from the Lower Mainland area. And if you're outside of the Lower Mainland area, then you can use the toll-free number at 1-888-422-2228, and again, extensions 1655. And a team of payment officer who looks after the pharmacy benefits will be able to address any questions that the pharmacy or you might have in terms of coverage for your medication. And how much is covered for each of your prescriptions? So for any medication accepted under the claim, then WorkSafe will pay for 100% of the drug cost, not including markup. Some pharmacies have an upcharge, and WorkSafe does not pay for the upcharge on the medication. And WorkSafe will pay the full dispensing fee up to $12 per prescription. And again, payment, just like with PharmaCare, is subject to generic substitutions and day supply policies. So coverage of brand name versus generic. WorkSafe will pay fully for the cost of the generic drugs, and certain drug plans, such as PharmaCare, have a list of which generics are fully covered and which are not. WorkSafe isn't that picky. All the generics are covered. So if your pharmacies carry the ultra generics, then go for it. The ultra generics are identical to the brand name. They have the same medicinal ingredients as well as the non-medicinal ingredients, and sometimes they come out of the same manufacturing plant as a brand name. And in instances that you try the generic and were not able to tolerate it, or if the generic didn't work as well, then WorkSafe will pay fully for the brand only if your physicians write no substitutions right on the prescription. And the pharmacy can override, use a code and override it so that there's no, you're not required to send in a request for coverage. The pharmacy can just override as long as your doctor writes no sub on the prescription. The one exception to the generic rule is that WorkSafe pays for brand name long-acting oxycodone, but not for generic, and that's for safety concerns with the usability of the generic oxycodone. And day supply, just like with PharmaCare, WorkSafe will pay for most pain medications up to 30-day supply, and if a worker gets more than 30-day supply, then they have to pay for the drug cost exceeding the 30-day supply. Chronic medications such as asthma medications are subject to 100-day supply. Certain medications such as the ones used to treat migraine headaches or erectile dysfunction are subject to a stricter rule. In general, an injured worker can only get 12 tablets of these medications a month. And in terms of early refills, the rule is a little bit different from PharmaCare. So for each prescription, you must have used at least 2/3 of your current prescription before you can get your next refill. For example, if you have a 30-day supply of medications on the prescription, you must have used up at least 21 days before you can get the next refill. And if the prescription was filled for a 100-day supply, then you have to have used at least 67 days before you can get the next refill. And again, for coverage for travel supply, you would need to get authorization from your case manager to have travel supply exceeding the 30-day supply or 100-day supply. However, WorkSafe does not cover for more than 30-day supplies of an opioid or a sedative or hypnotics at a time. And then you would have to pay for out-of-pocket for anything exceeding the 30-day supply. Reimbursement of prescriptions that you already paid for out-of-pocket before you receive your pharmacy benefits card, then you must submit your receipt, and I will just show you on the WorksafeBC.com website on how you can get a form so that you can get send in your receipts for reimbursement. So Michael, I'm just going to share the web page of WorkSafe BC right now.
Okay. There you go. So you just go to share.
Okay.
And then application. There you are. I'm seeing your browser now.
Okay, great. Okay, so just WorksafeBC.com and go to Forms. Click on Forms. It's taking its time right now. Oh, Michael, it's said on here, plug in. Okay, here we go. And there are different forms, and there are forms for the employers, there are forms for the workers, healthcare providers, and rehab providers. So go to the Workers tab, click on that, and the very first one, Worker Prescription Claim Form, the Form 3, and the Form 3A is used for supplies, including OTCs and other services claim. So just click on the Form 3, and this is a fillable PDF form, so you can actually fill it online. And if you have any questions, you can always call the payment services phone number, the same one that I've given before, 604-276-3085 and extensions 1655. Once the form has been filled, it can be faxed to this number right here, 604-233-6889, or toll-free 1-888-960-6889, or can be mailed to the payment services at WorkSafe at P.O. Box 94460, Station Main, Vancouver, BC, V6X8V6. And it's important that all of the required fields are filled in, and make sure you do include the WorkSafe claim numbers, and fill in the name of the medications, the date of purchase, the drug identification number, the prescriptions, and what is being prescribed for, the amount paid by PharmaCare, because WorkSafe does actually reimburse PharmaCare for the portions that PharmaCare has paid for, and the prescriber's name, and you must include your signature and a date, otherwise the form will be resent back to you, and include copies of the prescriptions receipt, not the cash register receipt, otherwise it will be sent back to you, and then it's going to take time if you don't have all the information submitted. Okay. We'll go back to the presentation. Okay. So we've already talked about how and where to send the forms in. So let's go to the next slide. OTC medications. Soon OTC medications are covered, but then again, only when prescribed by your doctors. Some examples are laxatives for opioid-induced constipation, if opioids have been accepted under the claim, and hemorrhoid therapy for treatment of hemorrhoids caused by opioid-induced constipation, again, if opioids have been accepted under the claim. Other things, even like medical adhesive tapes to keep the pain patches on, those are covered too, again, if they're prescribed by your physician. Make sure you do remind your doctor to put a note documenting all of your medications, including OTC medications, in the progress reports that they send to WCB. This would eliminate a lot of hassle for everyone, and payment can be processed more quickly if we have all the information when we receive the form. And WorkSafe will also pay for herbal homeopathic medications, but there are conditions that the payments are subject to. They must be prescribed by naturopaths within 8 weeks of the injury, and your treating physicians must have made the referral to the naturopath. The naturopath must invoice WorkSafe for the herbal and homeopathic medications. You should not have to pay for them out of pocket. And again, just remember that all treatments must be recommended and by your physician for them to be covered. Vitamins. In general, WCB does not pay for vitamins. In some special circumstances, they will be. For example, for a severely injured worker who have had like maybe resections of their bowel and they can't absorb the nutrients, then in those cases, WorkSafe will consider paying for vitamins. So I'm going to pass the phone back to Dr. Kyriazis to talk about veteran affair medication coverage.
We're back onto Veteran Affairs medication coverage. Veteran Affairs is another primary plan which offers coverage for drug products under the following programs, and this is specifically for veterans. They've got 3 programs: the standard benefits, special authorization benefits, and exceptional approvals. Under the standard benefits, many OTC and prescription drugs that represent common therapies are covered, and the individual must have a prescription for these products. Under special authorization benefits, these cover less common or higher cost therapies that have been approved by Veteran Affairs Canada. You must have a prescription and a medical need that requires the requested therapy. Now, under this section, the clients may be asked to submit medical tests or try more common therapies first. And then the third category is exceptional approvals, and these cover products that are not included on the formulary, which may be approved on an exceptional basis, provided that the client has a medical need and can show that this specific product is necessary and medically appropriate, and the other product will not work for the specific condition that the client has. Veteran Affairs drug coverage, the pharmacist can verify the patient's eligibility for a benefit at the time that the prescription is presented. Veteran Affairs covers many prescription drugs, and it also covers some over-the-counter medications. The eligibility criteria, clients must have a Veteran Affairs Canada Healthcare Identification Card on which an A or a B is indicated under the heading Program Number 10. Program Number 10 specifically refers to medication coverage because Veterans Affairs has got 10 different programs, all of which cover different aspects, for example, drugs or medical supplies or other health benefits. The Group A clients may only use a card to obtain benefits directly related to the treatment of their Veteran Affairs Canada pensioned medical condition, whereas Group B clients are eligible for approved benefits providing they have a clearly demonstrated health need and the benefits are not available to them under a provincial health plan. Now, in terms of Veteran Affairs, a veteran that comes into the pharmacy with a Veteran Affairs card, the billing will be done directly to Veteran Affairs as a primary provider. If Veteran Affairs does not cover a medication, then the pharmacist can request that the system is changed over to PharmaCare coverage as the initial coverage provider, and that item may be covered by PharmaCare if it's not covered by Veteran Affairs. For more information on Veteran Affairs, the website is www.veterans.gc.ca. Under English Services, Health, Treatment Benefits, and the program is number 10, and that refers specifically to the drug benefits. The next primary provider is NIHB, Non-Insured Health Benefits, Medication Coverage. This is Health Canada's National Health Benefit Program that provides coverage for medically necessary drugs for eligible registered First Nations and recognized Inuits. The NIHB program covers prescription drugs and some over-the-counter products that are listed on the NIHB drug benefit list. In order to be eligible for these products, the patient needs to have a prescription from a physician or any other licensed prescriber in BC. NIHB covers the cost of generic drugs, similar to PharmaCare. That's the lowest cost alternative drug. Again, a generic drug is a drug that has the same active ingredient as the brand name, and it offers the same therapeutic benefit, but it's a lower cost. In the case that a client cannot take the generic drug because of an adverse drug reaction to one of the non-active ingredients, then the NIHB program will cover a brand name drug at a higher cost, but documentation will be required from the prescriber explaining why the generic drug is not an option and why the brand name drug will have to be covered. When is prior approval required for drug coverage under the NIHB program? The pharmacist must obtain prior drug coverage approval when the drug is not on the drug benefit list, when the physician has written no substitution on the prescription, so in other words, when a brand name medication has to be covered, when the drug is listed as a limited use drug requiring prior approval, and when the drug is listed as a maximum allowable benefit, which means that the client has reached the quantity limits and needs to continue with the therapy. There are certain medications that are not covered under NIHB, and these include alternative therapies, megavitamins, any drugs with investigational experimental status, some over-the-counter products, and cough preparations containing codeine. For more information on the non-insured health benefits program, specifically related to drug coverage, the website is www.hc-sc.gc.ca, and then the rest of it takes you to this areas specifically related to drug medication coverage. So that concludes, well, that's a brief overview and a quick summary of the major drug coverage plans and benefits. If you have any questions, I think we have a little bit of time for questions. Is that right, Michael?
That is right. Let's see if we have...
Okay, or otherwise the questions can be emailed to communications@painbc.ca.
Yes, absolutely. So I would like to thank you so much, Drs. Nguyen and Kyriazis, for spending the time with us this afternoon and for putting up with the technical problems that we had earlier. I will be sending out a link to a recording of this session to everybody who registered. And we're looking forward to part 2, which happens at 11 a.m. 2 weeks from today on Thursday, February 27th. So if you're not already on Facebook and a fan of our page, I will send a link out to all registrants to sign up so you can join and share information, questions, and resources about this topic. Our Facebook page has well over 4,000 people who provide peer support and share resources and understand what it's like to live with ongoing pain. So if you have any comments or questions that you'd like answered for next time, you can email me at communications@painbc, which is up on the screen, or you can ask them on our Facebook page, and we'll do our best to answer them. So unless we have any questions from our participants, which it doesn't seem that we do at this point, we'll see you Thursday the 27th. And until then, here's hoping that tomorrow is a day free from pain for all of us.